Hello, and welcome to another episode in our Clinical Consults series. My name is Dr. CJ Michaud, our Director of Clinical Treatment at Industry Lab, and our focus today will be on toxicology, specifically the more than a dozen upgrades and enhancements we've made to our toxicology report to make it what we believe to be the most efficient, provider-friendly report on the market. Now, this video is geared toward an audience that is familiar with our current report. We'll do some compare contrast between the two. But even if you're new to Industry Lab, you'll be able to see the features of our toxicology reports that you'll be using as we move forward. So let's get right into it. Here's a side by side of the old and new reports. This is the same exact test and the same exact results presented, just shown a little bit differently. Now, on the new report, we continue to list the main confirmatory test results at the very top of the page, but instead of showing all substances together in one space, we have broken them out into two tables. Prescribed medications, or the things that you told us the patient is taking and that we should expect to find in the urine, and non-prescribed medications, or anything else the testing picked up that we didn't expect to find, which we think just makes this a little bit cleaner and easier to navigate rather than seeing them all together. Now, our complex interpretation logic is the same, and it's doing a lot of sort of math behind the scenes to present to you, but we've simplified the way that we present it. On the new report, we now simply have a consistent field, yes or no. We'll also color these inconsistent results red so that they will sort of flag you and draw your attention to make sure they get reviewed. You'll also notice now that we have grouped parent compounds and metabolites according to the medication being tested. So instead of wondering which analyte relates to which medication, or is this a metabolite or is it not, now it's all shown right here. So everything related to the Percocet is going to be shown here. Everything that was tested related to the Xanax is listed here, just to make the results a little more easy to interpret and make the report more efficient overall. Now, below these tables, we'll continue to list these historical reports. This information is the same so that you'll be able to review today's results in context with up to 6 prior tests that we may have performed for that patient. So no need to pull up old reports or go back in the chart. That'll be shown right here for you. And the next main upgrade on the first page is this validity testing that will now be shown here. One of the main things you want to know is, was this sample consistent with urine? Are these results that I'm looking at valid? And you used to have to flip back a few pages to the end of the report. Not anymore. That's now going to be shown right here. So you could make a habit of just looking in this bottom right corner. And if everything looked fine on that testing, you'll see within normal range every time. If something was out of range here, you'll see it say abnormal in this field, and it will usually have an explanation about what was off and maybe some possible reasons why that was the case. So we wanted that to be face up for you, so that was easy information to get access to. Again, making this first page as efficient as possible. Here's another example. Same concepts, a lot of the same information here, different test, but again, you can see the two tables over here instead of one. But this is a table that involves a drug screen and what we call our screen to confirmation testing, where we perform the drug screen first and then use those results to inform the confirmation testing. This screen information also used to show up further down the report, but in our attempt to pull all of the relevant info onto page one, we've moved it up here to the front. So now you can see the confirmation results, you can see the drug screen results, the historical data, if there is any. On this example, there was no prior testing to show, and the validity tests all on the first page of the report. Another thing I would point out is the inclusion of this detection window for every analyte that we test, so you can incorporate that information into your review and interpretation as well. The final thing to mention here is that this section of the report, this detailed information, line by line printout of everything that we tested, has been moved to the second page. Anything that was detected is still going to be found on these tables here on the front. So the primary use of this table is seeing what was tested but not detected. So if you viewed these results and thought, okay, but did they test for methylphenidate? That shows up in this table. And instead of placing that here, because this table can get pretty lengthy when we do a lot of testing, we didn't want that to take the place of other information. So instead, you can now see that information on the second page of our report, still shown line by line in a nice, easy to read format. And yes, there it is. They did test for methylphenidate. It was negative. It's all still there. We've just moved it to the second page in an easy to read table. So those are just a few of the main highlights that I wanted to hit. But again, more than a dozen enhancements have gone into this toxicology report to make Industry Labs Tox Report the simplest, most efficient, easy to read report that's out there. But we're never done improving, and we would love for you to reach out to us with your thoughts. Please connect with your sales representative. You can reach out to our clinical team at Report RX, or you can connect with us directly in the lab. We'd love your feedback or thoughts on how we can continue to partner with you to deliver results and improve patient care. Thanks so much for watching. Have a great day.